if you dedicate yourself to hear what the problem is, you perhaps could change the quality of life and longevity of life of that particular person. It's really a story of hope.
We care for kidneys.
We care for kidneys.
We care for kidneys.
We treat patients like we would want to be treated, so they really feel like they have a family outside of their own family.
I love my job. It's a great group to work with.
I think our staff go above and beyond.
The best part of my job is interacting with the patients and their families, watching people get better.
As far as I can remember, being a physician was the only thing I ever wanted to do. I have a passion for medicine and a passion for my patients.
We are a compassionate group of doctors. I really wanted to help people when I was very young. I got very sick. I lived in a very small town in India, and the doctor there took care of me 24 hours a day. He would not leave my bedside, and that passion really drove me to become a good doctor.
These are among the brightest guys that I've ever met.
We work to provide a lot of hope for our patients.
It's very rewarding.
There's tremendous amount of compassion going on from the beginning, from the moment you arrive here till the moment you leave. The mission of this practice to begin with was create a medical practice where the patient is the center. At the same time, apply the most advanced medical knowledge that there is in this field, and also utilize technology to its fullest.
Nephrologist, also called a renal physician, or also called a kidney doctor, they treat the kidney disease from A to Z.
Southeast Renal Care has a very comprehensive level of care, which starts from regular evaluation of patients with chronic kidney disease, hypertension, kidney failure, different modalities of dialysis, as well as a very active kidney transplant service.
By far the most common cause of kidney failure is diabetes and then high blood pressure.
When the kidney is no longer able to function to maintain life, we're very fortunate to have dialysis. And dialysis works as a kidney to help clean the blood and to help remove fluids so that way we can maintain life. At South Texas Renal Care, we try to ease the transition into dialysis as much as we can. We follow our patients very closely in our clinic and try to individualize a treatment plan for each one of them. When a patient requires dialysis, we urge them to follow a very strict diet in order to maintain their health. It requires drastic lifestyle modifications. At the very least, dialysis requires 4 hours, 3 times a week for a total of 12 hours.
An interventional nephrologist can access patients' vessels. Without a dialysis access, there's no dialysis, there's no life.
Typically when your kidney function gets less than about 30% is when we decide that we need to put the access in. And the access for dialysis is typically in the arm. We have it in early, and it's just sitting there and waiting until that decision is made to start you on dialysis.
We also provide quite a bit of procedures that are traditionally done in the hospital as an outpatient, and the hope is make the life of the patient better, increase the quality of life so they don't have to spend a number of days in the hospital.
Primary care physicians can identify those patients that develop renal failure, refer them to a nephrologist, and we can help them prevent the progression. I speak Spanish, I speak English, so I have the opportunity to help people. Queremos cuidar su riñón.
Once a patient reaches end-stage renal disease, which is defined as a kidney function less than 20%, the patient usually winds up waiting about 5 to 6 years for a deceased donor kidney. There's actually no wait time for live donor kidneys because there's no wait list. Essentially, if a patient has a potential live donor that is compatible, it is only a matter of scheduling the surgery.
By working directly with the Christus Transplant Institute, our goal is to facilitate kidney transplantation, which, as we know, is the ultimate cure for kidney failure.
A lot of our dialysis patients that obviously want to pursue transplant will be going to the transplant unit and there also see one of us, a familiar face. That continuity provides a peace of mind for the patient and the family.
These guys are sharp. They're efficient, not only well-mannered and well-disciplined and on time and all the things that a lot of people find important, but they know what they're doing and have an excellent set of connections with all their referral sources in the city. If you got to be on dialysis, this is the place to do it. Roadblocks are common on the way to transplant, whether it's living or cadaveric, and Dr. Mazzani and Dr. Brahman pushed them out of the way. The difference in my life now versus dialysis is a full order of magnitude different. With a transplant, I could easily live 20 to 30 years. I could not be more satisfied with the medical care I've received.
I think South Texas Renal Care is like a family. All the doctors work together. It doesn't matter who sees the patient one day, the other day, because we all talk to each other and we all want to deliver the best care that we can.
The combination of having a personal doctor, yet be in a group where you have a comprehensive resources, it will make a tremendous impact in the life of that patient.
We're able to communicate through Patient Portal, which is a web access where they have direct contact with their charts. If they want to email, change a prescription, change an appointment, ask the physician a question, they can simply send an email and get a response within 24 hours.
We have various dialysis clinics throughout the city. Depending on where the patient lives, we can provide them the clinic that is near to their home so that they do not have to travel far.
I was originally diagnosed when I was 10, so growing up, I didn't actually feel good, but when you are always not feeling good, you think that it's normal. My sister donated her kidney, but once I got the kidney transplant, it was like 180-degree change. I just feel great. I'm able to do things now. It definitely has changed my life.
I love working as a physician. You get someone patient better, you feel so good.
Having a research division is extremely important in any practice.
Clinical trials are drug experiments, help expand choices for patients and physicians to choose.
When a patient comes here, I don't just do a procedure. This is not a factory. This is a very care-oriented, compassionate practice.
Many times that my own kids ask me, "Dad, but you're not here," and it breaks my heart. I try to teach them that what I do, it really helps other folks, other families, so that there would be a mom and dad for them. Every day I wake up, I'm thinking about how else can I do things better? How can I impact the patient's life? Remain humble. Take care of the patient one by one. I'm very passionate about what I do.
We care for kidneys.
We care for kidneys.
We care for kidneys.
We care for kidneys.